Our patient today is a 59-year-old woman who had a gastric sleeve procedure and has lost 95 pounds. And this has left her with quite droopy breasts, and so we're going to perform a breast lift today. We're going to lift her breast. Her breast on this side is just a touch bigger than this side, so we're going to remove a little more from her left than from the right. We're also going to do some liposuction out here in the armpit areas to help take in that area as well. So let's head into the operating room and I'll show you her markings in the OR. Here are her markings. We're in the OR now, and you can see this is where her nipple and areolas are currently. We're going to move them up here. She doesn't look as bad lying down, which we all look a little better lying down. We're going to be removing the excess skin, bringing everything up, and then you can see here, do some liposuction on the sides to bring those sides in as well. So I'll show you how she looks when we're all done. I think she's going to get a very, very nice result. Okay, we are all done with the lift. Everything went really, really well. I covered up the nipples here, but she does have a little scar around her areolas. Coming down, you can see underneath. The little drain we're going to keep in just for 2 days. Did some liposuction of her sides as well, so that's going to contour really nicely there, as well as on that side. So I'll hopefully be able to show you her results when we're all done. Already getting a little swollen on the operating table. It's just going to get better and better. We are now 3.5 months after her surgery, and everything is healing really nicely. You can see she has still a little bit of the boxy shape of the breast that we see initially after a breast lift and reduction like this. She does have scars that extend around her areola down underneath. I'm just going to get a little bit closer here and see if I can show you those. Still a little bit red. The redness of the scars can persist sometimes as long as a year, but they really are healing very, very nicely, and you can see she's got a really nice shape that is just getting better and better. So really excited for her. I hope you found that interesting. Let me give you a few quick holistic plastic surgery tips if you're thinking about a breast lift. First thing is you gotta be okay with the scars. Scars are permanent. They will never disappear. If you have a breast lift now, you're gonna have those scars when you're 90 years old. Make sure you're okay with that. The second thing is don't be duped into a scar that is too short for your breast. For example, there is a lift called a donut breast lift where the scar is just made around the areola. Sounds pretty good, right? Hey, I'd like to have a breast lift and have just one little scar around the areola. Well, when you're really droopy, and if a doctor tries to do that type of lift on a droopy breast, what can happen is the areola can widen, and it can widen and widen. And I've seen areolas literally this wide on patients before. So be very careful if your doctor recommends a donut breast lift. So I hope that this was helpful for you. Check out these other videos right over here for more useful information.